Coming to today's topic, it is a ciliary ganglion. It has a peripheral parasympathetic ganglion about 1 to 2 mm in length diameter. So topographically it is connected to the nasociliary nerve and functionally it is related to the oculomotor nerve, the research cranial location. The apex of the orbit between the optic nerve and the origin of lateral rectus muscle, and it hangs from the nasociliary nerve. It is medial to the ophthalmic nerve. It has three roots, namely parasympathetic, sympathetic, and sensory. Parasympathetic also called secretomotor and sympathetic also called vasomotor. Coming to in detail, we have this diagram. Let me go in detail. We have three roots, right? That is parasympathetic, sympathetic, and sensory. So let's go in detail with each of them. So the first one here you are seeing it is nothing but Edinger-Westphal nucleus located in the midbrain at the level of superior colliculus. So it gives off the parasympathetic fibers. In parasympathetic you have pre and post ganglionic. So this is the preganglionic that's arising from the Edinger-Westphal nucleus and traveling around this. This one is nothing but oculomotor now, and it is passing through the oculomotor now, and then it is relaying in the ciliary ganglion. This is our ciliary ganglion that is we're discussing now. After relay, you call it as post-ganglionic fibers, and they leave the ganglion, they arise from this, and they shortly join the short ciliary now. At the end, it gives a branch to the inferior oblique. So before going into the sensory, let's go into the sympathetic now. So this is our T1 spinal segment. From the lateral horn, it arises our preganglionic fibers of the sympathetic system. It passes along this ganglion. What is this called? Superior cervical sympathetic ganglion, and it relays here, not in the ciliary ganglion. It relays here itself in this ganglion. And then the postganglionic fibers, they form the plexus around the internal carotid artery, and then along the ophthalmic artery, and then it passes along this way and passes through the ciliary ganglion without the relay, and then ends by supplying two intraocular muscles. Those are nothing but sphincter pupillae and ciliary muscles. So when we come to the sensory root, it is this one. This is the oculomotor nucleus. So this is our trigeminal now. That's the fifth cranial now, and this is our nasociliary now. Whose sensory fibers passes along this, and here it comes to the our ciliary ganglion without relaying. It passes through it, and it carries general sensations for the eyeball. That's all about this. The clinical aspect here is a ciliary nerve block, which indicates the dilatation of the pupil just before the cataract surgery. That's all about the ciliary ganglion, guys.